And all of a sudden the patient doesn't, oh, no, 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 you're not right. Every time it's like, oh my gosh, you're right. Has it been that long? I'm so embarrassed.
This is the Thriving Dentist Show with Gary Takis, where we help you develop your ideal dental practice.
But
Absolutely.
Isn't it interesting that most dentists are very willing to invest in more new patients. And yet every practice I know has a universe of existing patients in their practice that are less active or moving towards inactive. And I think there's plenty of business studies out there that show that it costs you less to keep, and I'll use business terms here, and then we'll transfer it to dentistry. It costs a business less to keep an existing customer than it does to create a new one. Are you familiar with that thinking and familiar with in business?
Yes.
It costs you less to keep an existing one than it does to attract a new one.
100% Gary. Yes.
And the same is true in dentistry, that it costs you less to keep an existing patient who, by the way, probably already knows, likes, and trusts you.
Right.
Now, maybe not as much as your loyal ones, but they probably already have some level of liking, trust, and appreciation for you. Is that a fair statement, Naren?
Absolutely. Especially if your practice is relationship driven, definitely they would have, know, like, and trust for sure.
And the reason they've drifted away isn't because they don't know, like, and trust you.
Yeah.
It's life. It's this merry-go-round that we're on. When we do reactivation, and I listen to these, when we do reactivation, Carly might say, if it was you, and let's say, we do it different ways. We can do it by text, we can do it by email, but we can do it by phone. Let's say it was a phone call and she might be saying, hey, Naren, this is Carly at your dental office. And I just realized we like to keep track of our patients. And I just realized it's been a while since I've seen you. I often hear the patient say, oh no, I was just there. Right. And then, Carly will say, well, let's see. Actually, Naren, you're right. You were here, but it was in late 2017. Mm-hmm. And all of a sudden the patient doesn't, oh, no, 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 you're not right. Every time it's like, oh my gosh, you're right. Has it been that long? I'm so embarrassed, And so I don't think there's any malice or there's any intentional avoidance. It's just this merry-go-round of life that we're on.
Yeah.
Causes distraction. And all of a sudden we know we're supposed to come in twice a year, but all of a sudden it's 2 years later and they haven't been in for an appointment. So they already know, like, and trust us, some at a greater degree than others. And it's a lot less expensive to reactivate those existing patients. And we're already probably well on the way of establishing rapport, relationship with those patients, where with a new patient, we've got to start from scratch.
One that provides personal, professional, and financial satisfaction.